Hello everyone, my name's Kitty Else Gamer and welcome back to SurgerySquad.com. I found 3 games that have interested me, and the first one is the braces. I've seen people with braces, but I don't know how they put on or anything like that. I've never had them, so let's have a look-see and learn something. Who are we going to have? Susie?
Welcome to Surgery Squad. I'm Dr.
Hello, Jeff.
And today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech.
Really?
Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
That does. Okay, I've done this before. I've done it in real life too. That's it, Clara. Yep. Right next to your cheek. Beep, beep.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
I didn't get that. I mean, it wasn't for braces, it was for something else, but I got the option. It tasted like silly putty.
Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
Next week.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth.
That's good.
Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Ugh. Imagine that if there was a bit of debris stuck in it. Ugh. Alright, let's give you some lovely pearly whites. That's it, make them sparkly. Just making sure. I don't know if I'm doing this right. I don't see any improvement. Okay, done.
Wow, what a marvelous job. I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
This is interesting. Is that the wisdom tooth? Let's not go there.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lid guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I'll run the suction to remove the water.
Okay. Spray. Make them nice. What's it like to have braces? Let me know in the comments. Is that enough?
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
I think so. That's it. Nice and dry. What happens if they're not nice and dry? Ooh. I think I want to know.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Bonder? Okay. You have to do that for each tooth. Oh, that could be tedious. And also when you have your mouth open, it either goes dry or you salivate, and that would be... Oh. I don't like thinking about it. Every time I'm at the dentist, I don't know what I want to do with my tongue every time my mouth's open. Squishy. How much is on that little bit anyway? It looks like a straw. Squishy, squishy, squishy. Squishy. I like these games, you learn something. Squishy. I'm done, doctor.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Oh. It's that tedious. Oh my. Oh, I'm so glad I don't need braces. Ah. I thought getting a filling was tedious.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Okay. Will that do?
Great job. Now I'll put the bonded brackets on the rest
Thank
of
you.
the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Okay.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
All right. This is weird. They look like little elastic bands. Well, technically they are, but for your teeth. Is that what they are? I thought they were like little plastic clippers. Oh. Who invented braces anyway? Of course, braces to us here are suspenders as well.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that.
Once a month?
Treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on surgerysquad.com?
Yeah, why is how to cook a turkey on the options? Not a day. Okay, next one is eye surgery, and I don't know how to pronounce that. LASIK. LASIK? LASIK. Let's have a look. Come on, be Susie.
Welcome to Surgery Squad,
Susie!
virtual LASIK eye surgery. I am Dr. Susie.
LASIK, I was right.
I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea.
Laser-assisted in situ keratomyolysis. I hope I said that right.
The part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Hey, I'm glad you said that, Dr. Susie, because no one wants to hear anyone screaming in pain during surgery. Ooh. Okay, yeah, I can do that.
Even with the numbing
Again, who
drops,
invents
it's
these
possible
things?
that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate
What do you mean
the
most?
procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum over the eye.
So weird.
If the
I'm not
patient was
squeamish,
allowed
but
to
it must be
blink,
so
we might
weird.
cut or burn the wrong area. At this point, we'll
Ew.
also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut.
Oh.
The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome.
Right, you saw the warning. If you're squeamish, look away.
This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
It's probably a good thing that the vision goes blurry, because you would not want to see that when on the receiving end. Oh, cool.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Oh, I hope I don't have to get this done, but still, it's really interesting. Come on.
This is the part we'll reshape with the laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position, making sure our ink guides match up.
Clever. Do you ever think who thought of this? Like, it's kind of scary, like the risk of like losing your eye altogether, even if your vision wasn't great in the first place. But someone came up with this idea and it was just crazy enough to work. But like I said, I hope I never have to have the surgery. I would not want it.
Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. it will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Wow. That was interesting. Okay, next one is epidural childbirth. And this will be interesting because I was an epidural childbirth. I was an epi baby. Who we got now?
Welcome to Parent Point. I'm Dr. Rachel, OBGYN, and I'll be walking you through an interactive childbirth with epidural today. The birth of a baby is the most remarkable thing that I get to experience. While much of the process during childbirth is the same from woman to woman, each birth is still unique in its own way. More than 2/3 of all babies born in the United States are delivered vaginally. Did you know that 60% of those use epidurals to relieve the pain? Most women find childbirth painful, and an epidural pain block can ease the pain. Epidural anesthesia blocks nerve impulses from the lower spinal segments. The medication is delivered through a catheter inserted between the bones of the spine.
I remember watching on QI one time and Stephen Fry was explaining the doctor who started the epidural, and most of me was thinking, what was he thinking? I mean, it worked, and like Dr. Rachel said, it's remarkable, and even too much pain can be a little, not good. So, wow.
The patient will begin to notice the numbing sensation about 10 to 20 minutes after the first dose. Only a tiny amount of the medication will reach the baby. After the epidural is administered, most women are able to relax or even catch a quick nap while their cervix dilates. When it comes time to push, contractions are much more manageable. Common side effects include nausea, heavy and numb feeling limbs, and a shivery, feverish, or itchy sensation. Some women develop severe headaches in the days following the epidural. A standard delivery is
kind of ironic since it's a pain relief,
typically lasting from 5 to 20 hours, depending on the conditions. The first stage is the beginning of labor, which is characterized by the onset of contractions and the dilation and effacement of the cervix. The epidural is normally given early in this stage. The next stage is the actual delivery of the baby. The final stage is the delivery of the placenta, which is an organ that connects the developing fetus to the uterine wall to allow nutrient uptake, waste elimination, and gas exchange via the mother's blood supply.
Yeah, most people take them home, and my question is, why? And I heard, don't ask me how I know this, but I've heard that placentas are full of vitamins, but I'm happy just taking a tablet. Not that I ever plan to do that.
Now that we've covered the basics, let's deliver a baby. Our patient today is in her early 30s and is in good health. She's in her 40th
and she's had braces done too.
She says that her contractions are coming 15 minutes apart. She is in the beginning stages of labor. After examination, we have discovered she is dilated to 4 centimeters. The patient has already discussed the anesthesia options and has chosen to go with an epidural to minimize discomfort. This won't harm the baby and shouldn't prolong our patient's labor significantly. The patient's...
Well, my mum had it.
Sits on the side of the bed leaning forward. She can also lay on her side with her knees pulled up. Either position extends the spaces between the bones of the spine. We feel for the space between the bones.
So this is what my mum had to put up with.
Use the marker to highlight the space.
Okay, like this. Can I just draw on your back? I'm giving you a new tattoo.
We'll use an iodine-based antiseptic solution to clean the area.
Dr. Jeff again? He owns everything. You're the dentist. He even owns the implants. No, I'm not talking about the dental stuff either. Alright. Make this nice and clean. So this is what you had to put up with, Mama Gamer.
And use a local anesthetic to reduce the pain of the epidural.
They think of everything, don't they?
Great.
Even the blood's coming out.
Let's insert the large epidural needle into the epidural space, which is just outside the spinal cord.
Oh, that must feel weird.
The needle slides into the space outside the membrane that surrounds the spinal cord. This area is the epidural space. Remember, the epidural never enters the spinal cord. We'll remove the syringe and leave a catheter in the epidural space. And then slip a thin tube called a cannula through the needle. Now that we've got the tube in place, we remove the needle, but leave the tube in the epidural space.
Do you remember any of this, Mom?
Next, we tape down the tube. Finally, we add the anesthetic. This epidural catheter remains in the body and allows us to infuse the patient while she is in the childbirth position. Once the epidural is in place, the patient feels nearly immediate relief. She can now concentrate on having her baby. Now we can move the patient onto her back and get her ready for labor. We'll attach a fetal monitor with 2 electrodes on the mother's abdomen to monitor the baby's heart rate as well as the strength of her contractions.
Okay. I think if I ever decide to have kids, I think this would be the best option.
In addition, a blood pressure cuff will be applied to check the mother's blood pressure throughout the procedure. Now that everything is in place and our patient is feeling as comfortable as possible, we'll feel her belly to check on the baby's position.
Okay. Yep, there's the baby's butt.
It feels like the baby is positioned to come out head first, so we don't have to worry about a breech birth, which is where the baby is positioned feet first.
That ain't good.
It seems like our patient's water just broke. This means that the amniotic sac is broken. We need to get our patient to assume the birthing position. The patient's cervix is effaced and fully dilated to 10 centimeters. We're headed for stage 2. Our patient is now having more frequent contractions. However, she is having little discomfort due to the epidural. She is also doing the breathing exercises she learned in her prenatal classes to help her concentrate and remain calm. Okay, now we want her to bear down and push.
For 40 seconds. Don't hemorrhage yourself. Yeah, I'm going to have to censor this.
Starting to get tired, but she's excited to know that the baby's head is crowning. Everything looks good. We don't need forceps or a vacuum to help the baby through the birth canal, but we will use our hands to help out a bit. This provides more space for the baby to come out.
Alright. Squishy. What are you hoping for, missus? Human reproduction is really weird.
The baby's head rotates as it exits the mother's body. We need to make sure the umbilical cord isn't wrapped around the baby's neck. So let's pause a moment
definitely.
To check. Everything looks great.
Nope, it's not.
Turn the baby's shoulder to slip out and the rest of the body follows right along.
I'll put the baby around the birth canal. Okay, I can do that. Aww.
And here's
it's a girl.
Baby. We need to remove excess fluid from the baby's airways using the suction bulb.
Aww. You got quite a bit of lungs on you, missus. I assume you're a girl because, well, you lack something.
To detach it from the placenta.
Yeah. I'm just assuming you're a girl because, you know, because you're so pretty. Okay, there we go.
It's a girl. While the baby
knew it.
In the Apgar test,
It was quite obvious.
The placenta is delivered in the final stage of birth. Just a little more pushing by mom, and the placenta is removed.
Ick.
Sometimes there can be tears to the cervix or vagina during birth. If this happens, we suture them. However, our mother is fine. One more thing we have to do is remove the cannula and catheter from the epidural.
Yeah, that would be pretty disastrous if she went home with that.
A small bandage is placed over the area. After that, Mom can get to know her baby. Great! Now all we're left with is the recovery process for our mother. Most new moms are able to walk and care for the baby within a few hours after birth. However, recovery after having an epidural may result in short-term numbness, increased recovery time, headaches, and other potential side effects.
I remember my mum telling me that she needed to lie down when they got home after she had me. And poor Claire was left with me.
The baby is examined by the pediatrician to make sure that our little one is doing well. A follow-up visit will be scheduled at the doctor's office in a week or two. Most healthy mothers and babies are discharged from the hospital the day after giving birth. It's important that new mothers eat well, drink lots of fluids, and avoid high-impact exercise for a few weeks. I also recommend that they sleep whenever they can, as it is hard to get much sleep with a new baby. If Mom spots any signs of infection, unusually foul-smelling discharge, extremely painful urination, or leg pain or swelling, she should contact her doctor. And if she is often depressed, as this may be a sign of postpartum depression, she should contact her doctor immediately. When the new family gets home, parents will spend lots of time feeding their baby, changing more diapers than they ever imagined, and get used to waking up at all hours of the night. They'll need to adjust to the baby's schedule and sleep whenever they can. Thanks for helping out. Why not check out the other great parenting procedures available here on ParentPoint.com.
Okay. Well, that was interesting. Now I know what my mother went through. Anyway, I'm going to end it here. I'll leave links in the description below if you'd like to play these games. Also, if you liked it, hit the like button and don't forget to subscribe for more. See you soon!